Today we'll be diving into a clinical condition which is seen affecting a lot of people around the globe. Or at least in my clinical practice, I have every 20th patient coming with this condition. It can be quite a perplexing condition since it introduces a symphony of sounds which only you can hear. So hello and welcome back to Ask Dr. Namrata, and today we'll be talking about tinnitus. So what is tinnitus? It is described by the presence of persistent sounds that can be present in your ears or in your head. So these can be either present almost continuously or can be present occasionally. Sounds like hissing, buzzing, ringing, whooshing, etc. have been described by the patients. So this is like having your own personal private concert which never seems to end, because these are not external sounds. Rather, these are sounds produced internally by your own auditory system. So tinnitus is like your own personal symphony, just like I said before, which can be either frustrating or quite isolating. What are the causes of tinnitus? The first cause, hearing loss. There are multiple tiny hair cells in your inner ear. These move whenever your ear receives sound. Now this movement of the hair cells triggers electrical impulses which are then carried by your nerve from your ears to your brain, and then the brain interprets these electrical signals or impulses as sound. Whenever these hair are either bent or broken, which can happen due to aging, or it can happen if you are constantly under the exposure of loud sound, then there is continuous leakage of these impulses to your brain, which produces tinnitus. The second common cause being ear infection or ear canal blockage. This can happen due to build-up of fluid within the inner ear, which occurs during ear infection, or build-up of wax or foreign material or dirt. This canal blockage causes change in pressure within the inner ear, as a result of which there can be tinnitus. The next common cause of tinnitus is head or neck injury. Whenever there is trauma to the head or neck, then there is affection of the nerves, hearing nerves, or either inner ear or either hearing centers in the brain. In these conditions, tinnitus is only in one of the ears. The next common cause of tinnitus are medications. There are certain medications which can either cause tinnitus or it can worsen tinnitus. Medications like NSAIDs, non-steroidal anti-inflammatory drugs, then antibiotics, then anti-malarials, antidepressants, certain diuretics, certain cancer drugs. There are many other causes of tinnitus. For example, temporomandibular joint disorders. These can cause clicking sounds. Then there is Meniere's disorder, which is characterized by dizziness, vertigo, as well as hearing loss or tinnitus. In fact, tinnitus can be one of the indicators of Meniere's disorder. Ear bone changes, stiffening of the bones in the middle ear, known as otosclerosis. Then next being muscle spasms, that is tensed up muscles within the inner ear. Then they can either cause fullness or pressure feeling within the inner ear, or hearing loss like condition, or tinnitus. Blood vessel disorders, wherein the conditions that affect your blood vessels like atherosclerosis, high blood pressure, or malformed or kinked blood vessels, these can cause increased pressure flow of blood within these vessels, as a result of which tinnitus can become more noticeable. Then there are other conditions like diabetes, thyroid, migraines, autoimmune disorders like rheumatoid arthritis, systemic lupus. All these have also been associated with tinnitus. How do we diagnose tinnitus? Routinely, physicians conduct local examination to rule out ear infections. Then there are hearing tests or audiogram, CT or MRI scan, as well as certain blood conditions. Tinnitus definitely has a lot of impact on your daily life. It is just not an innocent background sound, but it definitely causes a lot of changes in mood. It causes disrupted concentration. It causes disturbed sleep, as a result of which it is a condition which has to be addressed. What is the treatment approach in homeopathy? Now, even if the cause of tinnitus is found, the appropriate correction may not always resolve the perceived sounds, as a result of damage to cochlea. Hence, in homeopathy, we select certain remedies which have the capability of acting on the cochlea, at the same time taking into consideration the constitution of the patient. This is how we have individualistic approach. So the beauty of homeopathy lies in individualization. For instance, in the remedy graphitis, patients complain of cracking sound in the ears, which is aggravated on eating. There are hissing sounds in the ears. Also, there is detonation in the ear, just like report of a gun. In the remedy causticum, there are ringing, roaring and pulsating sounds which are accompanied by deafness. There is echoing of words and steps. This occurs due to the middle ear catarrh or accumulation of wax. These were just a few clinical tips for my fellow homeopathic students, and none of the patients or viewers watching this video are to buy medicines on their own, because I have just explained that homeopathy is all about individualization and no remedy per se will act generally on all people with tinnitus. I hope this information was resourceful to you. Up till my next video, stay healthy and stay fit.